Hello, my name is Dr. Matthew Link, and I am a licensed chiropractic physician in the state of Illinois. But I do not wish to address you today as a chiropractor, but as a healthcare professional wishing to provide you with a business opportunity that will not only benefit you, but your patients as well. If you are watching this presentation, you are probably a medical doctor or an osteopathic physician. Perhaps you're a chiropractor or a dentist. You may be a physical therapist or a clinical psychiatrist, or some other medical or health professional that owns, runs, or participates in a practice that sees patients regularly in an outpatient setting. Or maybe you are someone who is employed by or for someone in one of the above categories. Regardless of your background, it is of my hope that you will listen to this presentation with an open mind. This is not an attempt to coerce anyone into doing, selling, or buying anything, but my prediction is that the information that I have will make too much sense to be ignored or dismissed. Now, I'm sure I am like most of you when I say my education did not include any advanced training in nutrition, herbal medicine, or anti-aging medicine. And you may have patients who have been hospitalized for unwisely setting aside their entire prescribed hypertensive and diabetic medical regimen for one or few particular vitamins or herbs on the false belief that something is quote-unquote natural, and that makes it good or effective. And we have all heard on the radio and seen in TV and print media unsubstantiated claims of healing and cure made by various marketers of over-the-counter health products. Products of this type are not what you or I are interested in embracing. I am, however, interested in speaking of evidence-based medicine, sound and logical business practices, and how certain nutraceuticals can improve the lives of you and your patients. Now, we all know the face of healthcare is changing. Our patients are becoming educated, they know what they want, and they are willing to ask for it. Malpractice premiums are causing doctors to leave medicine or discontinue riskier aspects of their practice. This greatly affects their income production abilities. Reimbursements are continuing to decrease and write-offs are increasing. Average reimbursement rates are 60 to 70%, with some as low as 30% and going lower. Practitioners must see more patients to cover this loss, which causes a decrease in quality of care and an increase in frustration. Patients are becoming frustrated with chronic disease and obesity. Wellness is another area in which we are experiencing a revolution. This industry went from virtually nothing in the early 1990s to over $200 billion in the year 2000. This rapid progress has been fueled by the baby boomers, and in the next few years it is expected to reach over $1 trillion. Your patients are most likely already buying supplements in one form or another. Would you rather them buy from one of the big box stores so they receive the income? Or would you rather them buy through you so you not only know what they are getting for safety concerns, but you are also earning an extra income on those sales? The aging of our population is propelling these trends. Baby boomers make up over 1/3 of our population and contribute to over 50% of the economy. They are in their peak earning years and have created markets since their birth. Their fear of aging supersedes their fear of disease, and they have embraced the concept of self-care. This has been fueled by greater access to information, improved efficacy of wellness-based products and services, and a greater understanding of the molecular and genomic effects of macronutrients, micronutrients, and other nutritional compounds. Consider that 61% of Americans are overweight, with almost half clinically obese. Type 2 diabetes is becoming an epidemic, affecting our children for the first time ever. Many people are malnourished to the point where they live with constant headaches, body pain, heartburn, stomach distress, fatigue, and hundreds of other ailments. Patients are told that these are just symptoms of advanced aging and treated as disease with pharmacological agents rather than as preventable side effects of poor nutrition and exercise. Patients are seeking other solutions beyond simply reversing the trends of disease. Nutrimetrics Advanced Nutraceuticals has this solution. Based on the facts and statistics we have already discussed, It is apparent that wellness and anti-aging are more than just fads. They are trends that are here to stay and over the next few years will continue to explode. Statistics show that 42% of the American population is using some form of complementary and alternative medicine. Your patients are already spending their money on alternative medicine. Are you going to see this and position yourself to ride the tidal wave of growth that is quickly approaching? If so, how will you go about it? Consider this. Do you have patients who complain of fatigue in the absence of a particular treatable condition? Do your patients want to feel better and look younger? Are your patients getting reliable information about nutraceuticals from you or from others that may not give them the correct information? Do you have a need for reliable information on nutraceuticals that you can share with your patients? Do you make recommendations to people for nutraceuticals, directing those people to pharmacies and health food stores outside of your practice? Could you use more cash flow in your practice? And do you find yourself checking the mail daily for the third-party payer checks to meet your expenses? Most healthcare professionals are working the 30 to 35-year plan. After completing a medical education lasting 6 to 12 years and costing up to a few $100,000, they start working in their field around the age of 30 or 35. They are already 10 years behind their peers who began earning an income right out of college or high school. They often also start with the equivalent of a mortgage in student loans. They have to decide if they should become an employee, where they may have growth limitations, a fixed income, and a loss of their autonomy. They may decide to open a private practice, which equals more autonomy, but still multiple regulations, high overhead, dependence on third-party payers, and the income is tied to the number of patients you see and the level of reimbursement. Many health professionals at the end of the 30 to 35-year plan end up with less financial security than they had hoped for. Worse yet, many healthcare professionals are leaving their fields before they can complete their plan due to all the current difficulties. So what are your options? Well, you can see more patients, but many healthcare professionals are already at full capacity. Adding extra patients would decrease the quality of care. You can expand your services. This is an option, but often requires expensive equipment, more overhead, extensive training, and time. You can open additional offices. This requires much more overhead, time, and often headaches. You can close your office. This may remove some of the pressure to become an employee, but you still give up your autonomy. Many practitioners can't close their office without declaring bankruptcy due to accumulated debt. Others can't stop practicing because the tails on the malpractice premiums they would need to purchase are so high. Well, you can change your career, but that would take more time, more money to learn a new trade, and there is no guarantee that the new profession would be any better. Lastly, you can get into investments. This is risky, but considering the volatility of the stock market. Now, real estate is an option, but it takes capital, time, and knowledge of the business. NutriMetrix provides two ways for you to increase your income. You can provide the products from your office so you are earning 50% to 100% gross retail profit. Number two, you can leverage your time and duplicate your efforts with limitless possibilities by having other healthcare professionals doing the same service with their patients. So let's go through a brief example of how you can earn an income. In our example, let's start with, say your office has 4,000 patients. Let's set a goal of only having 10% practice participation. Now, this is a low goal, but it is achievable. Now, with that, we have 400 patients. In a 5-day work week, if you were to get only 2 patients per day buying their supplements through you, that would be just 10 in a week. In less than a year, you would be at your goal of 400 patients. Now suppose each of those patients buys an average monthly purchase of $52 worth of products. This is a total sale of possibly $20,800. The cost of those goods are $15,100, providing a gross retail profit to you for $5,700. And this is easy and can grow from there. Here is a summary of the isotonic capable supplements through NutriMetrix that I have been speaking of. Now, standard tablets and capsules have diluted nutrients because of the many binders and fillers they possess, and they are minimally absorbed into your body. As you can see, over 40 minutes can pass and these supplements are dissolving and releasing its contents into the stomach acid. Now, in my own personal experience, I've taken lumbar x-rays of a patient only to find the multivitamin tablet they took over an hour ago can still be seen undigested in their intestines. Now, in contrast, the isotonic supplements through NutriMetrix are highly concentrated because they are in a powder form that is mixed with water and then ingested. They are rapidly absorbed for maximum results. Within 1 minute of ingestion, the solution stimulates the opening of the pyloric valve and smooth muscle contractions move the solution into the small intestines. In the same 40-minute time frame, the isotonic supplement is already absorbed through the small intestine and not still remaining in the stomach. Well, it's time for you to grow. You don't have to keep every or any item in stock should you choose. I can work with you and your staff for product training. I can work with you and your staff to develop the best way to provide products for your patients. This will be an easy process. NutriMetrix will provide you with your own personalized website which is beautifully produced so you know that you will have a professional front end for your business. Your customers can go to this site to learn more on the products you have available, and they can make purchases here as well. If you'd like to see an example, please go to www.nutrimetrix.com/drlink as you see here. If you are viewing this as an employee of a health professional's office, I urge you to consult with your employer to add this to your services. It will not only benefit the patients, but greatly benefit you as well. Now, I know what you may be thinking. I don't have time to learn or run another business. This is only a minor hurdle which I am willing to help you with. We can also help your staff or someone else whom you'd like to have run this aspect of your business. It doesn't have to be you. So don't let this get in the way of potentially earning hundreds of thousands of dollars. Now, if you feel that due to your office structure that providing supplements cannot be implemented, I urge you to consider having your spouse or someone else on the outside of the office to run it for you. This can be someone you can direct patients to. In closing, please contact me as soon as possible to answer any questions and to get your office started. As you can see, I've listed my email below and my personal phone number. I look forward to speaking with you, and I know you'll have great success implementing this business into your business as well. I wish you a great day.